When the radiologists scanned him to assess the nature of the breakage, they found an extraordinary legacy of the First World War within his leg, still there. Gentleman, and this extraordinary object shows what went on within the gentleman's leg. And it was these fracture plates that he'd had after he was injured, shot in a communication trench in 1915. He came back, he was treated at the battlefield, and then came back and was fell under the care of long-term treatment at University College Hospital, where these plates were installed, and then for 68 years he lived with them within his leg. And you can even see just a small trace of his original bone still attached to the screws there. They'd seen large-scale injuries in industrial situations like the Manchester Ship Canal, where you're getting hundreds of orthopaedic injuries, and they'd seen large-scale military casualties in the Boer War. But the Great War and the trench warfare brings something that's just qualitatively and quantitatively entirely different. Any explosion, any gunshot wound isn't going to generate a nice, neat single fracture. It's going to produce what they call a compound fracture, multiple breaks in the bone, or the bone entirely shattered. And so established techniques of splinting weren't terribly effective.
And then if you could...
Guidance at the beginning of the war was simply to strap the rifle to the soldier's leg and stretcher them out of there. So we've got 10,000–11,000 surgical instruments. We're only showing 5 or 10%. They show a fraction of 1% of what they've got. It's extraordinary. Anything like
I think it's that we're going to...
This meant that the leg was stretched out and kept in suspension almost, and could be transported, because if the leg isn't effectively splinted during transport, it's going to generate incredible pain, it's going to generate more puncture wounds, it's going to generate more infection.
And then if you could do a clip.
You don't know what I'm seeing here, I suppose, in the viewfinder.
What's in